Good afternoon. This is Dr. Ngag again. I want to welcome you to my channel. Today, really, mine is brief and is actually to commend the majority of Kenyans or us who have actually tried to, follow a few rules that are really meant for the good of the community, the country. First of all, guys who have been on masks, guys who've been keeping that social distance, and above all, guys who've made sure their hands are clean, you know, irrespective of whether they're using soap or and water or sanitizer. So mine is actually to encourage you guys that let's not give up. We are almost, we are actually a couple of months into the disease, almost 3 months now. But you see, our numbers have really not gone up very high because of maybe the measures we've taken as a country. I'm not saying they're perfect, but actually, in a way, they have actually helped slow down the spread of this disease. Why I really need to commend these people is this is really not the end of it. We need to keep it up. We need to continue doing that social distancing. We need to wear masks, and above all, let's wash your hands. You see, when we say you're trying to break the chain doesn't really get broken until you start realizing that the number of people you're really discharging from the hospital are actually fewer than the number of people who are getting infected. That is the number of people you're picking per day. And imagine the percentage of people tested in this country are very few. So really, this may not really give a clear picture of what's going on. So in short, you really don't know if your colleague, as you go back to work, or your flatmate or apartment mate has this infection or not. So let's continue keeping that distance. I think it's good going back to work because we also really need to make ends meet. Most of us really rely on hand to mouth. So I'm really gonna stress on the fact that we really need to go back to our respective jobs, but then let's be slow in how we go back. Let's be careful and cautious on how we go back. Let's make sure that we keep that distance. Let's also make sure that we wash our hands, and of course we wear a mask. I mean, whichever mask you wear, be it a cloth mask or a surgical face mask. Remember, any mask in a way is gonna really prevent spread of the infection, even if the chance of really minimizing spread of infection is minimal. Remember, I often say that even a cloth mask is actually really gonna prevent you from splashing your body fluids through the nose or mouth to maybe someone that is close by. You see, myself, you see how my hair looks. Very, I rarely keep my hair this long. This is because of fear that going to a barber shop could really put me at a risk. Considering going, but you see, I'm still working on it. How am I gonna go there? And which part are they gonna shave? Which part are they really gonna skip? But I think what is more important is, as Kenyans, let's embrace the fact that we can actually go back to work and things go back to normal, but in a way that is actually going to make sure that we all pull through this thing. That is by keeping that social distance, by washing our hands and wearing masks. I think that really go a long way helping us, pull through. Let's also cooperate with the medical practitioners. I was shocked the other day, people trying to stop, doctors and the medical staff from picking a patient from somewhere in Old Town in Mombasa. I kept asking myself, really, why would you do this? Do you know the logic behind us admitting patients? Because the numbers are not so many, we are actually admitting them to minimize the spread to, to people close to them. Keeping them in hospital is a way of actually quarantining them or isolating them from the rest of the community members. But when the disease gets out of control, people are really going to be treated at home. You told, if you're not very sick, stay home. But you see, we haven't gotten to that stage, and that's why we really need to minimize chances of us getting to that stage. And I think this is really important that each and every one of us takes our health into our hands. Remember, if you die today, whatever you're really trying to look for, you may never get it. So let's try to be safe as we plan for maybe the future. I think that will be it for now. Please stay home to be safe. And if you at all you've got to go out, let's take those public health measures so that we actually could, save our country and ourselves. I think that will be it for now. Have a good afternoon. This is Dr. Ngaga.